Hi everyone, I am Dr. Anisha, a PG resident of Oral Medicine and Radiology, and today I have come up with one of the very important topics of oral medicine and oral pathology, that is your fibro-osseous lesions of the jaw. Now I shall be dealing the lesions one by one in the in this video and in the upcoming videos. We shall be talking about the WHO classification, different kinds of lesions of the jaws which are fibro-osseous in nature, one by one, okay. And before starting the discussion, I would like you to kindly subscribe to my channel for further videos. So firstly, let us talk about the introduction, in which we shall be dealing about the definition of fibro-osseous lesions. Then we will be talking about the historical background of the lesion. Then the importance in oral medicine, oral pathology and radiology. And finally, we shall be talking about the basic pathogenesis, wherein अगर मैं बहुत ही short में describe करूँ तो नाम से समझ में आ रहा है, जो आपका normal bone होगा, that will be replaced by fibrous connective tissue, also some of the unmineralized material. Fine. So let us start with the classification first, and in this आपको सबसे पहले, if you have been asked in the examination about any of the fibro-osseous lesions, fine, and its classification, we are supposed to write the WHO classification first. All right. So I shall be giving the WHO classification in the video also. So let us see what all lesions are we going to talk in this video and in the upcoming videos. So we shall be dealing with fibrous dysplasia, in which I shall be talking about the definition, etiology, its types, all right, clinical features, radiological features, okay, histopathological features and its management, right. Also the histopathological features of fibrous dysplasia will be dealt in another separate video, okay, so that it becomes very much clear for oral pathology also. Now coming to ossifying fibroma, okay, then again we shall be dealing with the definition, etiology, clinical features, radiological features, okay, histological features, then treatment plan and differentiation from fibrous dysplasia. Fine. Then we shall be moving on to the juvenile ossifying fibroma, then cemento-osseous dysplasia, and finally we shall be talking about some of the DDs of fibro-osseous lesions. All right. Now we shall be dealing with some of the important radiographic features also. Finally, I shall be talking about some of the important Viva questions also, and exam oriented summary will be given to you. Fine. So this was the overall content or the topics which I shall be touching in the video or in the upcoming videos, right. So let us talk first about the definition of fibro-osseous lesions, right. Now they are a group of pathological changes within the jaws, in which the normal bones are basically replaced by the fibrous tissue with or without calcification. I already told you, naam se samajh mein aa raha hai, it's very easy to learn, and also this definition was given by Waldron. Fine. So basically what happens is, jo aapka jo normal bone hoga, that will be replaced by the fibrous tissue with or without calcification. Fine. Now according to Eversole, fibro-osseous lesions refer to a collection of non-neoplastic intraosseous lesions that replaces normal bone and consists of cellular fibrous connective tissue within which non-functional osseous structures form. Fine. So basically again it says that the normal bone gets replaced by the cellular fibrous connective tissue, and within which non-functional osseous structures form, and so they are considered as fibro-osseous lesions. Fine. Now fibro-osseous lesions are a diverse group of processes that are characterized by replacement of normal bone by the fibrous tissues containing a newly formed mineralized product, and this definition was given by Neville, right. So these are few definitions which you can write in your examination, okay. Now we will be moving on to the WHO classification, which was given in 2005. Fine. Now let us talk about the WHO classification of fibro-osseous lesions of jaw, which was given in 2005. So firstly we have ossifying fibroma. You can see it in the screen. You can see on the screen, right? Then we have fibrous dysplasia. Then we have osseous dysplasia. Then in which we have periapical osseous dysplasia, then focal, and then florid variety of osseous dysplasia. Then we have familial giganticiform cementoma, right? Then next we have central giant cell granuloma, that is your CGCG. Then we have cherubism, then aneurysmal bone cyst, and then Staphynes bone cyst, right? So this was the classification, which is very important from examination point of view, and also we follow this classification for fibrous dysplasia, for fibro-osseous lesions. Fine. Then the next classification is by Eversole, which was given in 2008, in which we have bone dysplasia, and it consists of fibrous dysplasia, which further are of two types, that is monostotic fibrous dysplasia and then polyostotic fibrous dysplasia. Okay, then we have polyostotic with endocrinopathy. Fine. Then we have osteitis deformans or Paget's disease. Alright. One thing I would like to say that we shall be dealing with each and every lesion one by one, okay, in the upcoming videos. Fine. Then we have pagetoid heritable bone dysplasia of childhood. Then we have segmental odontomaxillary dysplasia. Fine. Then the next variety is cemento-osseous dysplasia, in which we have focal and florid variety of cemento-osseous dysplasia. Then we have inflammatory or reactive processes, which includes focal sclerosing osteomyelitis, diffused sclerosing osteomyelitis, proliferative periostitis. Fine. Then we have metabolic diseases, which includes hyperparathyroidism, and then we have neoplastic lesions, that is your ossifying fibroma. Okay. Then we have hyperparathyroidism, which is also known as jaw lesion syndrome. Then we have juvenile ossifying fibroma. Okay. Then giganticiform cementoma. Okay, this was all about your classification by Eversole. Again, it was given in 2008, and you can write it in your exams, right? Now let us start with the first lesion of fibro-osseous lesion, that is your fibrous dysplasia. It is also important from examination point of view. I am pretty sure that this question can come in your examination, your prof examination. So I would like you to go through this topic again and again, right? So let us start with the introduction of fibrous dysplasia. The term was coined by the scientist whose name was Louis Lichtenstein in 1938, right? It was first described by von Recklinghausen in 1981. So this is something which you can write in the introduction part, okay. Now coming to the definition of fibrous dysplasia. So fibrous dysplasia is a developmental tumor-like condition that is characterized by replacement of normal bone by an excessive proliferation of cellular fibrous connective tissue intermixed with irregular bony trabeculae. Now this definition was given by Neville, okay. Also, I would like you to understand this word by word, and it says that a fibrous dysplasia is a developmental tumor-like condition, fine, and it is characterized by the replacement of normal bone, okay. So the normal bone, again I am telling you, the normal bone is replaced by an excessive proliferation of cellular fibrous connective tissue. So bone की जगह जो सेल्यूलर फाइब्रस कनेक्टिव टिश्यू है वो उसे रिप्लेस कर देता है, एंड ऑल्सो इट इज इंटरमिक्स्ड विथ इर्रेगुलर बोनी ट्रैबेक्यूले, राइट. सो द बोनी ट्रैबेक्यूले आर इर्रेगुलर इन नेचर, फाइन. नाउ अकॉर्डिंग टू वॉल्ड्रॉन, fibrous dysplasia is believed to be non-neoplastic hematomous developmental lesion of bone of unknown origin, alright, and it is characterized by replacement of bone with fibro-osseous tissue, Okay, again very simple. Now this was the definition of fibrous dysplasia. Now let us talk about the etiology of fibrous dysplasia. So the exact etiology is unknown, but usually it occurs by the mutation in GNAS1 gene, alright. So there is a gene known as guanine nucleotide binding protein alpha stimulating gene. ओके सो आपका जो फाइब्रस डिस्प्लेजिया होगा उसमें ये जो आपका GNAS1 जीन है इसमें म्यूटेशन हो जाएगा एंड सो the functioning will be hampered and then fibrous dysplasia is going to get resulted. Okay, so the gene encodes a G protein. Now this gene, that is your GNAS1 gene, ये जो है ये G प्रोटीन को एनकोड करता है एंड इट स्टिम्युलेट्स द प्रोडक्शन ऑफ साइक्लिक AMP. फाइन. नाउ इफ आई टॉक अबाउट द स्टेजेस, अगर म्यूटेशन जो है वो अर्ली एम्ब्रियोनिक लाइफ में होगा तो मल्टीपल बोन लीजन्स प्लस क्यूटेनियस पिगमेंटेशन एंड एंडोक्राइन डिस्टर्बेंसेस हो जाएंगे विच इज कॉल्ड एज मैक्यून एल्ब्राइट सिंड्रोम. नाउ वी शैल बी डीलिंग इट in the further discussion, right? Now if the mutation occurs during later stages, then multiple bone lesions will be seen, that is known as polyostotic fibrous dysplasia. And if the mutation occurs during postnatal life, then there will be monostotic fibrous dysplasia. All right, so it's very simple to understand. अगर embryonic life के early stages में आपको ये म्यूटेशन नजर आएगा तो जो रिजल्ट होगा दैट विल बी वेरी सिवियर एंड दैट इज गोइंग टू इंक्लूड मल्टीपल बोन्स में फाइब्रस डिस्प्लेजिया आपको नजर आएगा विथ एंडोक्राइनोपैथीज एंड ऑल्सो स्किन पिगमेंटेशंस. फाइन. देन अगर आपके एम्ब्रियोनिक स्टेज के लेटर स्टेज में ये म्यूटेशन होगा देन ओनली मल्टीपल बोन्स आर गोइंग टू गेट इन्वॉल्व्ड, एंडोक्राइनोपैथीज उतना कॉमन नहीं होगा. एंड फाइनली अगर म्यूटेशन जो है वो पोस्ट नेटल लाइफ में अगर होगा तो मोनोस्टोटिक fibrous dysplasia is going to occur. Fine. So this was all about the etiology of fibrous dysplasia. Now let us talk something about the pathogenesis. अगर हम pathogenesis की बात करें तो I already told you जो आपका GNAS1 जीन है उसमें म्यूटेशन होगा. Alright, then also this gene is located on chromosome number 20. Please keep this in mind. And इस mutation के वजह से what happens is there is formation of excess cyclic. Okay, now what happens is जब ये जो cyclic AMP है इसका increase हो जाएगा, इनके levels का increase हो जाएगा. So what do they do is they prevent the differentiation of the cells within the osteoblastic lineage. जो आपका osteoblastic lineage में जो सेल्स है बोन फॉर्मिंग सेल्स है उनके डिफरेंशिएशन को ये प्रिवेंट करेगा एंड फाइनली जो भी बोन मटेरियल डिपॉजिट होगा उसमें एबनॉर्मैलिटी होगी. राइट. सो द फॉर्मेशन ऑफ बोन विल नॉट बी नॉर्मल. जो भी प्रोडक्ट बनेगा दैट विल बी वेरी एबनॉर्मल, दैट विल बी फाइब्रस काइंड ऑफ प्रोडक्ट. राइट. Now, continuous activity of G protein will lead to overproduction of cyclic AMP in the affected areas, and what will happen is there will be hyperfunction of the endocrine organs, right? And इसके वजह से again endocrinopathy can also be seen in the patient. And what all features can you see under endocrinopathy? Precocious puberty can be seen, all right? Hyperthyroidism can be present in the patient. Growth hormones and cortisol overproduction can be seen. Okay, these are some of the endocrinopathies which can be seen in the patient, right? Also, increased proliferation of melanocytes are one of the very important features which is seen in fibrous dysplasia, and they ultimately lead to skin pigmentations which are particularly known as cafeolate spots, right, with irregular margins. So these spots are going to have irregular margins. All right, this is something very important from Viva point of view also. Now, the effect of cyclic AMP will have abnormal differentiation of osteoblasts. I already told you the increased cyclic AMP are going to hamper the osteoblastic lineage and thus lead to fibrous dysplasia. So, I hope I have made this simple. The pathogenesis is very simple. GNAS1 जीन में म्यूटेशन होगा जिसके वजह से जो साइक्लिक AMP है उसकी प्रोडक्शन बहुत ज्यादा बढ़ जाएगी. एंड अगेन साइक्लिक AMP की प्रोडक्शन की बढ़ने की वजह से ये सारे फीचर्स आपको नजर आएंगे. सो दिस वाज ऑल अबाउट द पैथोजेनेसिस ऑफ फाइब्रस डिस्प्लेसिया. Now let us talk about the types of fibrous dysplasia. So monostotic type and polyostotic type, ये दो variety जो हैं they are very common. Apart from both of them, polyostotic fibrous dysplasia में आपको craniofacial fibrous dysplasia, Lichtenstein-Jaffe type of fibrous dysplasia and Albright syndrome, that is your McCune-Albright syndrome, ये तीन variety आपको देखने मिलेंगे. Now let us talk about the clinical features of monostotic fibrous dysplasia. So as far as epidemiology is concerned, ये 6 times more common है polyostotic fibrous dysplasia से. Also 80 to 85% of cases जो हैं वो monostotic fibrous dysplasia ही होते हैं. Now jaws are very commonly affected. The diagnosis can be made during second decade of life and males and female predilection अगर बात करूँ तो जो मतलब affected जो ratios हैं they are equally affected in both males and females. Fine. Now coming to the polyostotic fibrous dysplasia. Now ये जो है इसमें आपके multiple bones involved होंगे, नाम से समझ में आ रहा है. Okay, more than one bones are going to get affected in this. Now under polyostotic fibrous dysplasia, firstly we have craniofacial type. नाम से समझ में आ रहा है, the craniofacial bones are going to get involved and it involves face, base of skull, maxilla, mandible, craniofacial bones of course. Okay. Now occiput and base of skull are the most commonly seen locations of craniofacial type, right? Now the next category is your Lichtenstein-Jaffe type of polyostotic fibrous dysplasia, and again it involves multiple bones anywhere in the skull. Okay, the most important part is 3/4 skeleton is involved in this category of fibrous dysplasia, and it commonly affects the clavicle, pelvic bones, scapula, long bones, metacarpals and metatarsals, right? Now the disease was first seen at the neck of the femur and caffeolate pigmentations occur in this and endocrinopathy is rarely seen, right? So this is something which is to be kept in mind. And lastly, if we talk about McCune-Albright syndrome, now this is a syndrome, so we have different clinical features or a triad which are seen. Okay, and this triad includes firstly polyostotic fibrous dysplasia, then we have caffeolate spots, and with this precocious puberty can be seen. So three things which are to be kept in mind for McCune-Albright syndrome. Firstly, polyostotic fibrous dysplasia. Along with this, we have caffeolate spots, and lastly, precocious puberty will be present. Now, bone lesions are larger in this syndrome. There are skin pigmentations, and the pattern of spots is known as coast of Maine. Okay, and also they have irregular margin scenes. Okay. Now coming to the other clinical features which are present apart from all these. So pathological fracture can be seen with resulting pain and deformity. Okay, leg length discrepancy will be present and it involves upper portion of the femur. Of course, अगर upper portion of the femur involved है तो leg length discrepancy जो है वो present होगा, and that will be known as hockey stick deformity, right? Please keep this in mind. Now as far as endocrinopathies are concerned, ऐसे कौन-कौन से problems हैं जो endocrinopathy में include होते हैं? So it includes precocious puberty, seen in girls, genital enlarged in males, then hyperthyroidism, hyperparathyroidism and Cushing syndrome. We all know Cushing syndrome is excess cortisol production in the body. Now this was all about the clinical features of fibrous dysplasia. Now coming to the radiological features, so we will be studying it in three types. Firstly, we will be talking in respect to radiology of jaws, then we will be talking about the radiology of skulls and facial bone, and lastly we will be talking about the radiology of the skeletons, right? So firstly, अगर jaw के radiology की बात की जाए तो radiographically the location is more commonly seen in maxilla than in mandible, then posterior jaws are more commonly affected, and jaw lesions basically are monostotic, right? Now further, radiological manifestations are divided into three groups. Some lesions can have radiolucent nature, some lesions can have radio-opaque nature, and some can have a mixed lesion, right? Now if the lesion is radiolucent in nature, so the first appearance will be unicystic radiolucency with ring-like margin, alright? Now the lesions will have round, oval, irregular shaped with sclerotic margin, and sclerotic margin may show three appearances. Firstly, smooth, thin and sharply defined, which can resemble a cyst. Then the next variety will be thin but appears granular, and the third variety will be a wider band of increased density and it will be granular, right? Now coming to the radio-opaque lesions of the jaw, so the first variant will be orange peel or fingerprint appearance, okay? And lastly, coming to the mixed radiolucent radio-opaque lesion, so the lesion basically this variety of radiographic feature is very commonly seen, and the most frequent site is your mandible, right? Now radiology of the skull and facial bones, if is studied, all the appearances may affect skull except orange peel variant. So जो अगर आप radiology of skull and facial bones की बात करेंगे तो सारे appearances आपको नजर आएंगे except orange peel appearance or variant, right? So the facial bones or the base of skull involved shows extension into the adjacent sinus cavity. Now what happens is, अगर आपके facial bones या फिर base of skull जो है patient का वो involved है तो adjacent sinus cavity में इसका extension हो सकता है, right? Now we have a term called Leontiasis ossea. Now this is very important Viva question, and also the examiner expects you to write on the paper also. Now this pattern occurs when the site of involvement include anterior maxilla with extension into the maxillary antrum and the walls of the orbit, alright? Now please keep this in mind. Leontiasis ossea जो है basically fibrous dysplasia which involves anterior maxilla, and the extension will be into the maxillary antrum and the walls of the orbit, okay? And propoptosis of the eyeball will be seen, and sphenoid bone will be involved, right? Now coming to the last variety of radiological feature, that is your radiological feature of skeleton, okay? Now what can be seen if we study the radiological features of the skeleton? The skeleton bone is involved. Now the primary site is your metaphysis of long bone, okay? Now curvature of femoral neck and proximal shaft of the femur can be involved, and this condition is going to be called as Shepherd's crook deformity, alright? ये एक बहुत ही important Viva question है. What is Shepherd Crook's deformity? Please keep this in mind. अगर fibrous dysplasia जो है वो curvature of the femoral neck को involve करेगा and proximal shaft of the femur को involve करेगा, तो जो deformity होगी that will be known as Shepherd's Crook deformity, alright? Very important Viva question. Now there will be shortening of leg, limping, okay? Now, secondary spinal defect and back pain can be present in the patient. Bowing deformity will be present, and expansion of ribs will be seen. Alright. So, these are some of the features, radiological features which can be seen in fibrous dysplasia if it involves the skeleton of the body. Okay. Now, coming to the complication, pathological fractures can be seen, aesthetic problem will be present, psychological aspects will be hampered in the patient, then massive cartilage hyperplasia can be present, accelerated bone growth can be seen, and finally sarcomatous degeneration will be can be present in the patient. So, these are some of the complications which are seen in fibrous dysplasia. Now, coming to the treatment portion, finally, the treatment of choice is surgery. Okay. Now, if there is a lesion which is very small in size, then excise and toto is to be done. And if the lesion is large enough, then correction of aesthetic and functional disturbances has to be the priority. Alright. So, this was all about fibrous dysplasia. Okay. In the next video, I shall be dealing with the histopathological features of fibrous dysplasia in a very detailed manner. So I shall be talking about some of the very important Viva questions and exam related questions. So I want you to subscribe to my channels for all such further videos. So this was all about it. Okay. If you have any doubts, you can get back to me in the comment section. Thank you so much.